Okay, so this is chapter 8. It's the chapter in the Milady Standard Cosmetology book on skin disorders and disease. By the end of this chapter, you'll be able to recognize common skin lesions as well as describe the disorders of the sebaceous glands, name and describe changes in the skin pigmentation, identify forms of skin cancer. You'll know 2 major causes of acne and how to treat them. List the factors that contribute to the aging of the skin, effects of overexposure to the sun on the skin, contact dermatitis and how to prevent it. With the arrival of the 20th century came the scientific study of proteins found in the hair, skin, and nails, made possible by the molecule by molecule breakdown of DNA by high powered microscopes. While the level of knowledge needed by scientists is not necessary for cosmetologists, a thorough knowledge of the underlying structures of the hair, skin, and nails would help you to achieve the best possible results when providing hair, skin, and nail care services while at the same time providing the utmost protection for your client. So, touching back on chapter 7, a dermatologist is a physician who specializes in diseases and disorders of the skin. Inflamed skin disorders, whether infectious or not, should not be served in the salon. Lesions of the skin. A lesion is a mark on the skin or structural change in tissues caused by injuries or disease. You have 2 types of lesions, and they are primary and secondary. Primary lesions are listed here. The first one is a bulla or a blister. A cyst is a sac containing fluid or pus. A macule is a discolored spot or patch on the surface of the skin, such as a freckle that is neither raised or sunken. A nodule is a solid bump larger than 0.4 inches. A papule is a pimple, a small circumscribed elevation of the skin that contains no fluid but may develop pus. A pustule is a raised, inflamed pimple. It does contain pus. A tubercle is an abnormally rounded, solid lump above, within, or under the skin. It's also larger than a papule. A tumor is an abnormal skin cell mass, a swelling, and it results from multiplication of cells varying in size, shape, and color. Nodules are also referred to as tumors, but are smaller. A vestule is a small blister with clear fluid, such as poison ivy, and it lies within or just beneath the epidermis. A wheal is an itchy, swollen lesion lasting only a few hours. It's caused by a blow, the bite of an insect, or urticaria, and that is a skin allergy such as hives or stinging needle. Secondary lesions are later stages of skin disease, or they develop in later stages of skin disease. Crust is a buildup of dead cells formed over a wound or blemish while it's healing. An accumulation of sebum and pus mixed with epidermal material, or it's otherwise known as a scab. Excoriation is a skin sore or abrasion produced by scraping or scratching. So when you have a rash, or say you have poison ivy and you scratch and you break those tiny vestules, you'll end up with an excoriation. A fissure is a crack in the skin that penetrates into the dermis, such as chapped lips. You can also have fissures on the bottom of your feet too. A keloid is a thick scar resulting from excessive growth of fibrous tissue. A lot of time people get those with piercings, or I've seen myself after surgeries. Scale is any thin plate of dry or oily epidermal flakes, or like excessive dandruff. A scar or cicatrix is a light colored, slightly raised mark on the skin formed after an injury or lesion of the skin has healed. And then an ulcer is an open lesion on the skin or mucous sprain of the body. It's accompanied by pus and loss of skin depth. Sebaceous gland disorders. Comedones are otherwise known as blackheads. They are follicles filled with keratin and sebum. Milia are otherwise known as whiteheads. They are benign keratin-filled cysts that appear just under the epidermis and have no visible opening. They resemble round sesame seeds. Acne is characterized by chronic inflammation of the sebaceous glands from retained secretion and propionibacterium. It occurs frequently on the face, back, and chest, also known as common pimples, acne simplex, or acne vulgaris. A sebaceous cyst is a large, protruding pocket-like lesion that's filled with sebum. Seborrheic dermatitis is a condition caused by an inflammation of the sebaceous glands. It's often characterized by inflammation, dry or oily scaling or crusting, and or itchiness. Red flaky skin also appears, or it often appears in the eyebrows, in the scalp and hairline, in the middle of the forehead, and along the sides of the nose. Let's see. Asteatosis is a condition of dry, scaly skin characterized by absolute or partial deficiency of sebum due to old age and exposure to cold. Rosacea is next. It's a chronic inflammatory congestion of the cheeks and nose. Rosacea is characterized by redness, telangiectasis, or dilation of the blood vessels, and formation of papules and pustules. Factors that aggravate rosacea are spicy foods, caffeine, alcohol, exposure to extreme heat, colder sunlight, and stress. A steatoma is a sebaceous cyst or a fatty tumor filled with sebum ranging in size from a pea to an orange, sometimes called a wen. These usually appear on the scalp, neck, and back. Sudoriferous gland or oil gland disorders. We have anhidrosis, which is a lack of perspiration. It's often the result of a fever. Bromhidrosis, also known as osmodrosis. It's a foul-smelling perspiration. Hyperhidrosis is excessive perspiration caused by excessive heat or general body weakness. Milia ruba is also known as prickly heat. It's an acute inflammatory disorder caused by an eruption of small red pustules and accompanied by burning and itching. It's caused by exposure to excessive heat. Skin inflammations. And you may not know this, but it falls under a skin inflammation because it involves your eyelid. But the first one we have is conjunctivitis or pink eye. It's a common bacterial infection of the eyes, extremely contagious, and should be referred to a physician. Discard products or implements that have touched an infected eye. Dermatitis is an inflammatory skin condition with lesions. Eczema is a skin inflammation of acute or chronic nature, presenting many forms of dry or moist lesions. It's also accompanied by itching or burning. Herpes simplex is a recurring contagious virus infection commonly called fever blisters, characterized by an eruption of a single vestule or group of vestules, Lord, on a red or swollen base. Impetigo is a contagious bacterial skin infection characterized by weeping lesions. It normally occurs on the face and most frequently seen in children. You'd need to refer to a physician for this. Psoriasis is a common chronic inflammatory skin disease. Its cause is unknown and it's found on the scalp, elbows, knees, chest, and lower back, but it's rarely found on the face. Skin pigment. Your skin pigment can be affected by internal factors such as heredity or hormonal fluctuations, or external factors like sun exposure. Dyschromia is an abnormal coloration. Every skin disorder and many systemic disorders are accompanied by dyschromia. Hyperpigmentation means the skin is darker than normal, so you'll have dark splotches. And then hypopigmentation is the absence of pigment, so you have light or white splotches. Changes in skin pigmentation, which I don't think the first one is a change since it's genetic or congenital. But your first one is albinism. Congenital leukoderma, or the absence of melanin pigment of the body, skin, hair, and eyes, is known as albinism. Hair is white, skin is pinkish white, and will not tan. Eyes are pink, and the skin is sensitive to light and ages early. Chloasma is characterized by increased deposits of pigment in the skin, found mainly on the forehead, nose, and cheeks, also called moth patches or liver spots, generally caused by cumulative sun exposure. My grandmother also used to call those old age spots. Latinges are freckles or small yellow to brown spots on parts of the body exposed to sunlight and air. Leukodermia is light abnormal patches the skin has that are caused by a burn or congenital disease that destroys the pigment producing cells. Vitiligo and albinism are examples of this. A nevus is a birthmark, a small or large malformation of the skin due to abnormal pigmentation or dilated capillaries. Stains are abnormal brown skin patches that have a circular or irregular shape. They occur during aging, after certain diseases, after the disappearance of moles, freckles, and liver spots. A tan changes the pigmentation of the skin caused by exposure to sun or ultraviolet rays. And then vitiligo is a hereditary condition that causes hypopigmented spots and splotches on the skin. It also may be related to thyroid conditions and other autoimmune diseases. Hypertrophies of the skin. The first is a keratoma, or also known as a callus. It's an acquired superficial round thickened patch of epidermis caused by pressure or friction on the hands and feet. If it grows inward, it's called a corn. A mole is a small brownish spot or blemish on the skin believed to be inherited. It ranges in color from pale tan to brown to bluish black. Some are small and flat, others are raised and darker. Caution, do not remove hair from moles. A skin tag is a small brown or flesh-colored outgrowth of the skin. It occurs most frequently on the neck of an older person. A verruca, or otherwise known as a wart, is caused by a virus. It can spread from one location to the other, particularly along a scratch in the skin. Types of skin cancer. If caused by overexposure to the sun, skin cancer comes in three distinct forms, varying in severity. Basal cell carcinoma is the most common and the least severe type. It's also often characterized by light or pearly nodules. Squamous cell carcinoma is more serious than basal cell carcinoma and often characterized by red, scaly papules or nodules. And then malignant melanoma is the most serious form of skin cancer. It's often characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised. Often called the city person's cancer because it may be located on parts of the body that aren't exposed to the sun or on individuals who do not receive regular sun exposure. Skin cancer checklist. A for A for asymmetry, B for border, C for color, D for diameter, and E for evolving. If there are any changes noted, consult with the physician. Acne and problem skin. Retention hyperkeratosis is the hereditary tendency for acne-prone skin to retain dead cells in the follicle. P. acnes is anaerobic. It means it cannot survive in the presence of oxygen, and that is the bacteria that causes acne. Acne feeds on fatty acids. So, what are some ways that you can treat acne? Cleansers and toners that are formulated for oily and acne-prone skin. They're usually foamy and they're rinse-off products that remove excess oil. And then toners are designed for oily skin to help further remove excess sebum. Follicle exfoliants are leave-on products that help remove cell buildup from the follicles, allowing oxygen to penetrate the follicles and kill bacteria. Commonly used ingredients in these are known as AHA or alpha hydroxy acid, salicylic acid, and benzoyl peroxide. Benzoyl peroxide can be especially effective since it not only helps shed cellular debris, but it also kills the acne bacteria. Avoidance of fatty skincare and cosmetics is important because the products that contain large amount of fatty materials and oils can cause follicles to clog from the outside. Make sure all makeup and skincare products used on an acne-prone person are non-comedogenic, which means the product has been designed and proven not to clog pores or follicles. Do not use harsh products or over-clean acne-prone skin. This can cause inflammation that can worsen the condition. Intrinsic aging factors. This is genetic aging, which is how our parents' skin age. They're coloring and resistant to sun damage. Gravity, the constant pulling downward on our skin and bodies, and then facial expressions. Repeated movements of the face result in formation of expression lines such as crow's feet, lines around the eyes, nasolabial folds from the corners of the nose to the mouth, and scowl lines between the eyes. Extrinsic aging factors: sun exposure, smoking, excessive alcohol, illegal drugs, cumulative stress, poor nutrition, and exposure to pollution. The sun and its effects. So 80 to 85% of aging is caused by the sun's rays. UVAs weaken the collagen and elastin fibers, and the UVB rays are also known as the burning rays that cause sunburn and tanning by affecting the melanocytes. Sun exposure precautions. Avoid prolonged exposure. Apply sunscreen liberally 30 minutes prior to exposure and after swimming. Use broad or full spectrum sunscreen. Avoid exposing children to sun under 6 months old. Wear a hat and protective clothing outdoors. Dermatitis. Dermatitis is the medical term for abnormal skin inflammation. It can result from contact with chemicals or tints, or allergies from product ingredients. Contact dermatitis is the most common work-related skin disorder, and it's caused by certain substances touching the skin. And there are a couple of different kinds of contact dermatitis. You have the allergic contact dermatitis, which is caused when the skin is allergic to an ingredient or product. Sensitization is an allergic reaction created by repeated exposure to a chemical or substance. Irritant contact dermatitis is caused when irritating substances temporarily change the epidermis. For example, corrosive substances or exfoliating agents. You can avoid this by wearing gloves when working with irritating chemicals. Self-protection. Ways to protect yourself from getting contact dermatitis. Keep all your tools and surroundings clean. Proper disinfection of brush handles, containers, surfaces, etc. Wear protective gloves and keep your hands clean and moisturized. So in summary, what's a skin lesion? A lesion is a mark on the skin. It can be as simple as a freckle or as dangerous as a skin cancer. Lesions can indicate skin disease disorders and may indicate other internal diseases. Name and describe at least five disorders of the sebaceous glands. Comedone or blackhead. It's a worm-like mass of hardened sebum in the hair follicle. Milia are small deposits of sebum between the hair follicle and the corneum that resemble sesame seeds. That's also known as whiteheads. Acne is characterized by chronic inflammation of the sebaceous glands from retained secretions. Seborrheic dermatitis is a skin condition caused by an inflammation of the sebaceous glands, often characterized by redness, dry or oily scaling or crusting, and or itchiness. Rosacea is a chronic condition appearing primarily on the cheeks and nose, characterized by redness, telangiectasis, and in some cases, formation of papules. Sebaceous cyst is a large protruding pocket-like lesion filled with sebum. Name and describe at least five changes in skin pigmentation. Albinism is the absence of melanin. Chloasma is characterized by increased pigmentation. It causes spots that are not elevated. Lithinges is a term for freckles. Leukodermas are light abnormal patches. Nevus or nevi, plural, are commonly known as birthmarks. Stains are abnormal or wine-colored skin discolorations with circular and irregular shape. Tan is the change in pigment caused by exposure to the sun or UV rays. And vitiligo is a loss of pigment. Name and describe three forms of skin cancer. Basal cell is the most common and least severe, characterized by light or pearly nodules. Squamous cell carcinoma is the more serious one and is characterized by scaly red papules or nodules. And then you have malignant melanoma, which is the most serious form, characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised. What are the factors that contribute to aging of the skin? Sun, environment, health habits, general lifestyle, genetics, and gravity. Explain the effects of overexposure to the sun on the skin. UV rays weaken the collagen and elastin fibers, causing wrinkling and sagging. What is contact dermatitis and how can it be prevented? Contact dermatitis of the skin is caused by having contact with certain chemicals or substances that are used in cosmetology. Contact dermatitis can be prevented by keeping brush handles, containers, and tabletops clean and free from products, dust, and residues. Wearing protective gloves whenever using products known to cause irritation or allergic contact dermatitis with repeated contact. And then keeping your hands clean and moisturized. And that's going conclude Chapter 8, Skin Disorders and Diseases.